Plastic surgery. Plastic surgery is a surgical specialty involving the restoration, reconstruction, or alteration of the human body. It can be divided into two main categories: reconstructive surgery and cosmetic surgery. Reconstructive surgery includes craniofacial surgery, hand surgery, microsurgery, and the treatment of burns, while reconstructive surgery aims to reconstruct a part of the body or improve its functioning, or cosmetic or aesthetic surgery aims at improving the appearance of it. Etymology. The word plastic in plastic surgery means reshaping and comes from the Greek plastike techne, the art of modeling, of malleable flesh. This meaning in English is seen as early as 1598. The surgical definition of plastic first appeared in 1839, preceding the modern engineering material made from petroleum, since by 70 years. Treatments for the plastic repair of a broken nose are first mentioned in the 16th BC Egyptian medical text called the Edwin Smith Papyrus. The early trauma surgery textbook was named after the American Egyptologist Edwin Smith. Reconstructive surgery techniques were being carried out in India by 800 BC. Sushruta was a physician who made contributions to the field of plastic and cataract surgery in the 6th century BC. Sushruta's developments were preserved in his book Sushruta Samhita. The Romans also performed plastic surgery using simple techniques such as repairing damaged ears from around the 1st century BC. For religious reasons, they did not dissect either human beings or animals. Thus, their knowledge was based in its entirety on the texts of their Greek predecessors. Notwithstanding, Aulus Cornelius Celsus left some surprisingly accurate anatomical descriptions, some of which, for instance, his studies on the genitalia and the skeleton, are of special interest to plastic surgery. The Indian medical works of both Sushruta and Charaka, originally in Sanskrit, were translated into the Arabic language during the Abbasid Caliphate in 750 AD. The Arabic translations made their way into Europe via intermediaries. In Italy, the Branca family of Sicily and Gaspare Tagliacozzi Bologna became familiar with the techniques of Sushruta. British physicians traveled to India to see rhinoplasties being performed by Indian methods. Reports on Indian rhinoplasty performed by Kumar Vaidya were published in the Gentleman's Magazine by 1794. Joseph Constantine Carpew spent 20 years in India studying local plastic surgery methods. Carpew was able to perform the first major surgery in the Western world in the year of 1815. Instruments described in the Sushruta Samhita were further modified in the Western world. In 1465, Sabuncu's book Description and Classification of hypospadias was more informative and up-to-date. Localization of urethral meatus was described in detail. Sabuncuoglu also detailed the description and classification of ambiguous genitalia. In mid-15th century, Heinrich von Pfollspunt described a process to make a new nose for one who lacks it entirely, and the dogs have devoured it by removing skin from the back of the arm and suturing it in place. However, because of the dangers associated with surgery in any form, especially that involving the head or face, it was not until the 19th and 20th centuries that such surgery became common. In 1814, Joseph Carpew successfully performed an operative procedure on a British military officer who had lost his nose to the toxic effects of mercury treatments. In 1818, German surgeon Karl Ferdinand von Graefe published his major work entitled Rhinoplastic. Von Graefe modified the Italian method using a free skin graft from the arm instead of the original delayed pedicle flap. The first American plastic surgeon was John Peter Mettauer, who in 1827 performed the cleft palate operation with instruments that he designed himself. In 1845, Johann Friedrich Diefenbach wrote a comprehensive text on rhinoplasty, titled Operative Chirurgy, and introduced the concept of reoperation to improve the cosmetic appearance of the reconstructed nose. Another case of plastic surgery for nose reconstruction from 1884 at Bellevue Hospital was described in Scientific American. In 1891, American otorhinolaryngologist John Rowe presented an example of his work. A young woman on whom he reduced the dorsal nasal hump for cosmetic indications. In 1892, Robert Weyer experimented unsuccessfully with xenografts duck sternum in the reconstruction of sunken noses. In 1896, James Israel, a urological surgeon from Germany, and in 1889, George Monks of the United States each described the successful use of heterogeneous free bone grafting to reconstruct saddle nose defects. In 1898, Jacques Joseph, the German orthopedic trained surgeon, published his first account of reduction rhinoplasty. In 1928, Jacques Joseph published Nasenplastik und sonstige Plastic development of modern techniques. The father of modern plastic surgery is generally considered to have been Sir Harold Gillies, a New Zealand otolaryngologist working in London. He developed many of the techniques of modern facial surgery in caring for soldiers suffering from disfiguring facial injuries during the First World War. During World War One, he worked as a medical minder with the Royal Army Medical Corps. After working with the renowned French oral and maxillofacial surgeon Hippolyte Morestin on skin graft, he proceeded the Army's chief surgeon. Arbuthnot Lane to establish a facial injury ward at the Cambridge Military Hospital, Aldershot, later upgraded to a new hospital for facial repairs at Sidcup in 1917. The Gillies and his colleagues developed many techniques of plastic surgery. More than 11,000 operations were performed on more than 5,000 men, mostly soldiers with facial injuries, usually from gunshot wounds. After the war, Gillies developed a private practice with Rainsford Mowlem, including many famous patients, and traveled extensively to promote his advanced techniques worldwide. In 1930, Gillies' cousin, Archibald McIndoe, joined the practice and became committed to plastic surgery. When World War II broke out, plastic surgery provision was largely divided between the different services of the armed forces, and Gillies and his team were split up. Gillies himself was sent to Rooksdown House near Basingstoke, which became the principal army plastic surgery unit. Tommy Kilner, who had worked with Gillies during the First World War and who now has a surgical instrument named after him. The Kilner cheek retractor went to Queen Mary's Hospital, Roehampton, and Mowlem went to St. Albans. McIndoe, consultant to the RAF, moved to the recently rebuilt Queen Victoria Hospital in East Grinstead, Sussex, and founded a centre for plastic and jaw surgery. There he treated very deep burn and serious facial disfigurement, such as loss of eyelids, typical of those caused to aircrew by burning fuel. McIndoe is often recognized for not only developing new techniques for treating badly burned faces and hands, but also for recognizing the importance of the rehabilitation of the casualties and particularly of social reintegration back into normal life. He disposed of the Convalescent forms let the patients use their service uniforms instead, with the help of two friends, Neville and Elaine Blonde. He also convinced the locals to support the patients and invite them to their homes. McKindo kept referring to them as his boys, and the staff called him the boss or the maestro. His other important work included development of the walking stock skin graft and the discovery that immersion in saline promoted healing as well as improving survival rates for victims with extensive burns. This was a serendipitous discovery drawn from observation of differential healing rates in pilots who had come down on land and in the sea. His radical experimental treatments led to the formation of the Guinea Pig Club at Queen Victoria Hospital, Sussex. Among the better known members of his club were Richard Hillary, Bill Foxley, and Jimmy Edwards. Plastic surgery is a broad field and may be subdivided further. In the United States, plastic surgeons are board certified by American Board of Plastic Surgery. Subdisciplines of plastic surgery may include aesthetic surgery. Aesthetic surgery is a central component of surgery and includes facial and body aesthetic surgery. Plastic surgeons use cosmetic surgical principles in all reconstructive surgical procedures as well as isolated operations to improve overall appearance. Burn surgery. Burn surgery generally takes place in two phases. Acute burn surgery is the treatment immediately after a burn. Reconstructive burn surgery takes place after the burn wounds have healed. Craniofacial surgery. Craniofacial surgery is divided into pediatric and adult craniofacial surgery. Pediatric craniofacial surgery mostly revolves around the treatment of congenital anomalies of the craniofacial skeleton and soft tissue such as cleft lip and palate, microtia, craniosynostosis, and pediatric fractures. Adult craniofacial surgery deals mostly with the reconstructive surgeries after trauma or cancer and revision surgeries, along with orthognathic surgery and facial feminization surgery. Craniofacial surgery is an important part of all plastic surgery training programs. Further training and subspecialization is obtained via craniofacial fellowship. Craniofacial surgery is also practiced by maxillofacial surgeons. Ethnic plastic surgery. Ethnic plastic surgery is plastic surgery performed to change ethnic attributes, often considered used as a way of passing. Hand surgery. Hand surgery is concerned with acute injuries and chronic diseases of the hand and wrist, correction of congenital malformations of the upper extremities, and peripheral nerve problems such as brachial plexus injuries or carpal tunnel syndrome. Hand surgery is an important part of training in plastic surgery as well as microsurgery, which is necessary to replant an amputated extremity. The hand surgery field is also practiced by orthopedic surgeons and general surgeons. Scar tissue formation after surgery can be problematic on the delicate hand, causing loss of dexterity and digit function if severe enough. There have been cases of surgery to women's hands in order to correct perceived flaws to create the perfect engagement ring photo. Microsurgery. Microsurgery is generally concerned with the reconstruction of missing tissues by transferring a piece of tissue to the reconstruction site and reconnecting blood vessels. Popular subspecialty areas are breast reconstruction, head and neck reconstruction, hand surgery, replantation, and brachial plexus surgery. Pediatric plastic surgery. Children often face medical issues very different from the experiences of an adult patient. Many birth defects or syndromes present at birth are best treated in childhood, and pediatric plastic surgeons specialize in treating these conditions in children. Conditions commonly treated by pediatric plastic surgeons include craniofacial anomalies, syndactyly, webbing of the fingers and toes, polydactyly, excess fingers and toes at birth, cleft lip and palate, and congenital hand deformities. Prison plastic surgery. Plastic surgery performed on an incarcerated population in order to affect their recidivism rate, a practice instituted in the early 20th century that lasted until the mid 1990s, separate from surgery performed for medical need. Techniques and procedures. In plastic surgery, the transfer of skin tissue, skin grafting, is a very common procedure. Skin grafts can be derived from the recipient or donors. Autografts are taken from the recipient if absent or deficient of natural tissue. Alternatives can be cultured sheets of epithelial cells in vitro or synthetic compounds such as Integra, which consists of silicone and bovine tendon collagen and glycosaminoglycans. Allografts are taken from a donor of the same species. Xenografts are taken from a donor of different species. Usually good results would be expected from plastic surgery that emphasize careful planning of incisions so that they fall within the line of natural skin folds or lines, appropriate choice of wound closure, use of best available suture materials, and early removal of exposed sutures so that the wound is held closed by buried sutures. Reconstructive surgery. Reconstructive plastic surgery is performed to correct functional impairments caused by burns, traumatic injuries such as facial, bone fractures, and breaks, congenital abnormalities such as cleft palates or cleft lips, developmental abnormalities, infection and disease, and cancer or tumors. The goal of reconstructive plastic surgery is to restore both form and function. The most common reconstructive procedures are tumor removal, laceration repair, maxillofacial surgery, scar revision, hand surgery, and breast reduction plasty. According to the American Society of Plastic Surgeons, the number of reconstructive breast reductions for women decreased in 2018 by 4% from the year before. Breast reduction in men decreased in 2018 by 8%. In 2018, there were 57,535 performed. Some other common reconstructive surgical procedures include breast reconstructions after a mastectomy for the treatment of cancer, cleft lip and palate surgery, contracture surgery for burn survivors, and creating a new outer ear when one is congenitally absent. Plastic surgeons use microsurgery to transfer tissue for coverage of a defect when no local tissue is available. Free flaps of skin, muscle, bone, fat, or a combination may be removed from the body, moved to another site on the body, and reconnected to blood supply by suturing arteries and veins as small as 1 to 2 millimeters in diameter. Cosmetic surgery procedures. Cosmetic surgery is a voluntary or elective surgery that is performed on normal parts of the body with the only purpose of improving a person's appearance and or removing signs of aging. In 2014, nearly 16 million cosmetic procedures were performed in the United States alone. The number of cosmetic procedures performed in the United States has almost doubled since the start of the century. 92% of cosmetic procedures were performed on women in 2014, up from 88% in 2001. Nearly 12 million cosmetic procedures were performed in 2007, with the five most common surgeries being breast augmentation, liposuction, breast reduction, eyelid surgery, and abdominoplasty. The American Society for Aesthetic Plastic Surgery looks at the statistics for 34 different cosmetic procedures. 19 of the procedures are surgical, such as rhinoplasty or facelift. The non surgical procedures include Botox and laser hair removal. In 2010, their survey revealed that there were 9,336,814 total procedures in the United States. Of those, 1,622,290 procedures were surgical. Page 5. They also found that a large majority, 81% of the procedures were done on Caucasian people. Page 12. The American Society of Plastic Surgeons (ASPS) estimates that more than 333,000 cosmetic procedures were performed on patients 18 years of age or younger in the US in 2005 compared to approximately 14,000 in 1996. This is significant because it encourages younger people to continue these procedures later in life. The increased use of cosmetic procedures crosses racial and ethnic lines in the US, with increases seen among African Americans, Asian Americans, and Hispanic Americans, as well as Caucasian Americans. Of 1191 UK newspaper articles, 89% use the term plastic surgery in the context of cosmetic surgery. This is significant as it shows the frequency in which the Western world portrays cosmetic surgery. In Asia, cosmetic surgery has been more popular, and countries such as China and India have become Asia's biggest cosmetic surgery markets. South Korea is also rising in popularity due to the expertise in facial bone surgeries. The first publication by a team of South Korean surgeons on facial bone contouring surgeries was published, illustrating various surgery methods used for facial bone contouring surgeries. Plastic surgery is increasingly slowly, rising 115% from 2000 to 2015, according to the annual plastic surgery procedural statistics. There were 15.9 million surgical and minimally invasive cosmetic procedures performed in the United States in 2015, a 2% increase over 2014. A study from 2021 found that requests for cosmetic procedures had increased significantly since the beginning of the COVID-19 pandemic, possibly due to the increase in video conferencing. Cited estimates includes a 10% increase in the United States and a 20% increase in France. In 1949, 15,000 Americans underwent cosmetic surgery procedures. By 1969, this number rose to almost half a million people. The most popular aesthetic cosmetic procedures include abdominoplasty, tummy tuck, reshaping, and firming of the abdomen, blepharoplasty, eyelid surgery, reshaping of upper lower eyelids, including Asian blepharoplasty, phalloplasty, penile surgery, construction or reconstruction of a penis, or sometimes artificial modification of the penis by surgery, often for cosmetic purposes, mammoplasty, breast augmentations, breast implant, or boob job, augmentation of the breast by means of fat grafting, saline, or silicone gel prosthetics, which was initially performed for women with micromastia, reduction mammoplasty, breast reduction, removal of skin and glandular tissue, which is done to reduce back and shoulder pain in women with gigantomastia and for men with gynecomastia, mastopexy, breast lift, lifting or reshaping of breasts to make them less saggy, often after weight loss. After a pregnancy, for example, it involves removal of breast skin as opposed to glandular tissue, augmentation mastopexy, breast lift with breast implants, lifting breasts to make them less saggy, repositioning the nipple to a higher location, and increasing the breast size with saline or silicone gel implants. Recent studies of a newer technique for simultaneous augmentation mastopexy (SAM) indicate that it is a safe surgical procedure with minimal medical complications. The SAM technique involves invaginating and taking the tissues first in order to pre-visualize the final result before making any surgical incisions to the breast. Buttock augmentation, butt implant, enhancement of the buttocks using silicone implants or fat grafting, Brazilian butt lift, where fat is transferred from other areas of the body. Cryolipolysis refers to a medical device used to destroy fat cells. Its principle relies on controlled cooling for non-invasive local reduction of fat deposits to reshape body contours. Cryoneuromodulation treatment of superficial and subcutaneous tissue structures using gaseous nitrous oxide, including temporary wrinkle reduction, temporary pain reduction, treatment of dermatologic conditions, and focal cryo treatment of tissue. Calf augmentation done by silicone implants or fat transfer to add bulk to calf muscles. Labiaplasty, surgical reduction and reshaping of the labia. Lip augmentation, alter the appearance of the lips by increasing their fullness through surgical enlargement with lip implants or non-surgical enhancement with injectable fillers. Caloplasty, surgical reconstruction of the lip. Rhinoplasty, nose job, reshaping of the nose sometimes used to correct breathing impaired by structural defects. Otoplasty, ear surgery, ear pinning, reshaping of the ear, most often done by pinning the protruding ear closer to the head. Rhytidectomy, facelift, removal of wrinkles and signs of aging from the face. Neck lift, tightening of lax tissues in the neck. This procedure is often combined with a facelift for lower face rejuvenation. Broplasty, brow lift or forehead lift, elevates eyebrows, smooths forehead skin, mid-face lift, cheek lift, tightening of the cheeks. Genioplasty, augmentation of the chin with an individual's bones or with the use of an implant, usually silicone by suture of the soft tissue. Mentoplasty, surgery to the chin. This can involve either enhancing or reducing the size of the chin. Enhancements are achieved with the use of facial implants. Reduction of the chin involved reducing the size of the chin bone. Cheek augmentation, cheek implant, implants to the cheek, orthodontic surgery, altering the upper and lower jaw bones through osteotomy to correct jaw alignment issues and correct the teeth alignment. Fillers injections, collagen fat and other tissue filler injections such as hyaluronic acid, brachioplasty arm lift, reducing excess skin and fat between the underarm and the elbow. Laser skin rejuvenation or laser resurfacing, the lessening of depth of facial pores and exfoliation of dead or damaged skin cells. Liposuction, suction lipectomy, removal of fat deposits by traditional suction technique or ultrasonic energy to aid fat removal. Zygoma reduction plasty, reducing the facial width by performing osteotomy and